Good afternoon, everybody, and welcome to the latest edition of the Recentre Lunchtime webinar series. The Recentre, as you can see from the slide, conducts research evidence that enables professionals and policymakers and the research community to understand and improve outcomes for children's social care and education. The presentation today is by Professor Julie Selwyn of the Recentre. There are two main parts to it, and questions will be taken at the end of each section. I will guide you through that. I'm honoured to introduce Julie Selwyn, Professor of Education and Adoption here at the Recentre. Many here today and online will no doubt be familiar with Julie's work, but for those who've not had the opportunity to engage with it, Julie's research bridges many areas, including children's social care, adoption, health, and education. We are here today to learn more from the much anticipated findings from the DFE-funded 8-year longitudinal study, Family Roots, Growing Up in Adoptive and Special Guardianship Families, a study that aims to understand the experiences, needs and outcomes of young people aged 12 to 25. That's a far on, we'll just wait for that to stop. Test. Thank you. And their parents and carers during adolescence and then transition to adulthood. So with no further ado, it's my great pleasure to hand over to Julie, who will guide us through these findings.
Thank you, Andrew. I thought that fire alarm we were going to be doing this for again. So I'm here to talk about Family Roots. As Andrew said, it's a longitudinal study and it's quite rare for DFE to fund longitudinal work in social care. I have 3 partners in the work. Ecorus are the lead partner, and the Recentre, one of the other main partners, and the other group are Ipsos. And we're all involved in different elements of the study. So Ecorus are leading interviews with families, with the parents and the carers and the children. I'm leading the linked administrative part of the study, and Ipsos are leading surveys. So just to give you a bit of background to this, the study was designed to explore the needs, experience and outcomes of care experiential people aged 12 to 25 in permanent types of placements. Now, there's very little known about that age group, 12 to 25. There's lots known about younger children, under 12s, but very little known about young people, especially as they transition to adulthood. And it's particularly important because at the moment, courts are making some rather strange decisions, saying, oh, children don't really need to be placed for adoption. They can stay in long-term foster care. It's just as stable. Why do we need to think about permanence? Is it as important in today's world? Aren't all these things just the same? Aren't they all relative? So this study is really important in terms of thinking about the longer-term outcomes for children. And today I'm going to think about 2 bits. First, the stability of adoption and special guardianship orders. And secondly, that's published. And secondly, it's about to be published, children in long-term foster care and their educational outcomes. Welcome, come and join me. So for those who are not involved in the social care world, just to say a little bit about what we mean by permanence. So all children in care have to have a permanence plan in place by their secondary year. So that's 4 months after they come into care. Okay? And this is the framework for all social work practice. And it says in the statutory regulations that the objective of planning for permanence is to ensure that children have a secure, stable and loving family to support them through childhood and beyond. That's really important. Not just through childhood and beyond, to give them a sense of security, continuity, commitment, identity and belonging. That is the framework for all social work practice. So from the minute a social worker gets involved with a family, that's what they should be aiming for. And that's what's in the statutory regulations. It's quite interesting, just as an aside, that the recent care review undertaken by Judge McAllister never once mentioned permanence or this definition. Completely omitted from that review. But there are different types of permanence. Okay, there's reunification, which is returning a child home. Kinship care, living with a relative, which is what kinship means, usually, or a friend of the family. Child arrangement orders, that's often made to another parent or sometimes a relative. But today we're going to be talking about adoption, special guardianship, and long-term fostering. Now, an adoption order has been around since 1926. Long time. An adoption gives the parent, an adopted parent, complete parental responsibility. So an adopted parent can change a child's name. It's as if the child was born to them. Okay? So they have complete parental responsibility. A special guardianship order is usually made to a relative. And the order ends at 18. It's not lifelong, like adoption. Again, it's usually made to a relative, usually a grandparent, and it's made in quite different circumstances. And then there's long-term fostering. Oh, I should have said, special guardianship's only been available since 2005, so it's much more recent. Long-term fostering, although it's been around a long time, it's only been legally defined since 2015. So it was set out in regulations in 2015. So I'm going to be talking about the stability, first of all, of adoption and special guardianship orders. So what's the stability of these two orders? For the first time, we've been able to look up what were the trajectories and outcomes. What happened to the kids when they came back into care if these orders disrupted? Disrupted, I mean breakdown. What happened to them? Now, for those who are a bit nerdy like me, who like data and who like doing linked administrative data, linking all these data sets together, this is all the data I was given. Wow. So, first of all, we were given social care data. So this is what's known as the episode data. So this is all the reasons why children come in and out of care, all their placements, all the orders that are made, all the legal orders. We were given outcome data, so something called the SDQ. This is the Strength and Difficulties Questionnaire, which is a measure of mental health. Whether they had substance misuse problems, whether they had criminal convictions, and the care leaver data, where they were living, whether they were in employment or education. We had all the education data, so whether they had special educational needs, their Key Stage 2 data, Key Stage 4, that's like GCSE data, whether they were in pupil referral units or in alternative provision, Key Stage 5, A-levels, whether they were excluded, whether they were persistent absentees, something called the individualised learner record. So this is post-16 data, whether they were in further education. Something called the National Client Caseload Information System, which is collected by local authorities on young people post-16 who have education and health care plans. So this is a very vulnerable group of young people, post-16. And then a data set that I found particularly useful, which is the young person's matched administrative data, the YPNAD, which is matched by DFE and links children across all these different data sets including children in independent schools, because many of these other data sets don't include children in the independent sector. And many adopted parents send their kids to private schools. So this is one of the only data sets where you get adopted children appearing, all adopted children appearing in that bottom data set. Yeah, and HESA is university data.
Sorry, Julie, the NR is
Not requested. Not requested, sorry. And the ticks are what we got. I could spend a whole seminar explaining some of the problems with this data, but no time today. Not much anyway. So disruption for this was defined as a return to care. I should say that is a bit of a problem in terms of just thinking about what we mean by breakdown. Children could be living at home in really unhappy circumstances. A disruption, parents are sometimes desperate to get services and they send their children back into care just so that they will get a service. It doesn't mean that the relationship is necessarily broken down. Yeah, so I've had to use return to care as, it's not necessarily a negative, but that's the way we've had to define it for the study, because there is no other way in the data to do it. So the sample was all adoptions since 2004, which was over 68,000, and all special guardianship orders, which was over 40,000. And we had to look through all these data sets to try and find them, because it's not easy to identify these children in the data sets. Yes. I'm going to stop you in a minute, because otherwise I'll not be able to do it, Leon, in 20 minutes.
or carry on.
No, you can't say.
I just wonder where the adoption record is.
It's held in lots of different places. It's in the episode data, because children, you can see children leaving on an adoption order, because it's an episode, because they leave on an order. But we were also given an adoption file, which included adoptions before 2004. From 2015, though, local authorities are meant to record when children come back into care if they're left on any order. But we have huge problems and data inconsistencies. And I'm just highlighting here some of the problems we faced with this data, in that there were over 1,500 children who were appearing, for example, in the education data, as though they were adopted. But when we looked in the social care data, they'd never left care on an adoption order. So it looked as though their teachers had got really mixed up, thinking they were adopted when they weren't, because they'd left. The social care data was showing that they'd left on a special guardianship order, whereas their teachers were recording them as leaving on an adoption order. So there was lots of confusion about these different orders. So because they weren't in the social care data, we had to exclude that group from our analysis. So let me say something about the children. And obviously we wanted to look at the characteristics of the kids in these two groups. How similar, how different were they? So boys and girls, pretty similar across the two groups. More Black, Caribbean and African children in the special guardianship group. Okay, so more Black children, Black, Caribbean and African in the SGO group. Statistically more. If it's in red, it's a statistical difference. The whole study is based around a risk and protective theoretical model and latent vulnerability. So we were looking at what were the sort of risk and protective factors before the children left care. So really interestingly, the adopted children had many more moves in care before they were placed for adoption. So the adopted children had You know, if you just look here, you know, only 11% have just one carer, whereas 52% of the SG children have a single carer. And that was because we think children coming into care were placed with a relative who then went on to become their special guardian. Whereas children who then had an adoption recommendation came in as an emergency, placed with a foster carer, then went on into another foster care placement, shifted again into another foster care placement, finally getting into an adopted placement. So by the time they were 2, they'd already had probably 4 different foster placements, never mind all the moves they'd had before they entered care. Because typically, we know from Harriet's earlier work that children were moving round even before they entered care because the parents were shifting children round. But the adopted children were entering care younger and leaving care younger, which is a protective factor. So that's just to give you an idea of the child's age when they left care for adoption or special guardianship. You can see that most of the children leaving for adoption are leaving at younger ages, under 4, and the tail goes right up to 17 for the SGs. But of course, that older age may have lived with those special guardianship carers for longer before leaving on the order. So by March 2023, 970 of that very large number of adoptions had disrupted and 1890 SGOs. So 8 years after the order, 10% of the SGOs had disrupted and just 2% of the adoptions. Very, very low numbers of disruptions compared to the numbers of foster care placements that disrupt every year. There is a very, very high rate of disruptions in the care system. Just a graph showing you how that changes. You can see, you know, it's fairly steady disruptions across the 8 years for adoption and a fairly steep rise for the SGRs. Time in care and time to disruption. So a longer time in care was linked to more adoption disruption. So 58% of the adoption disruptions occurred for children who'd waited 3 or more years in care. And of course, the longer they waited in care, the more foster placements they had. What I didn't expect, and this was an unexpected finding, was that 44% of the SGR disruptions occurred for kids who left quickly. Now, we've always thought of longer time in care. We've always thought that quick exits from care are a protective factor, but for SGOs, it was the opposite. So the children, maybe this was because inadequate assessments were being done, SGOs weren't being prepared properly, but 44% of the SGO disruptions were where the kids left quick. So age of disruption, very similar, 7 for both groups. The adopted families held on to the kids for longer. So average age at disruption was 14 for the adopted children and 11 when the SGO children came back into care. DFE have been very pleased with these findings, although I'll give you some caveats. You can see that from 2015, the disruption rates have decreased, especially for the SGO children. In 2015, the virtual school head was extended to include adoption and SGOs. From 2015, the Adoption and Special Guardianship Fund was introduced, which provided therapy funding for children in adoption and special guardianship, and the Pupil Premium Plus. So there was an awful lot of intervention from 2015. Policy changes were introduced. We also had COVID, of course, so there was a decrease in the number of children entering care in 2019, 2021, but not a steeper decline than that in the number entering care. So there is a positive story here in terms of policy intervention. So factors predicting adoption, these are regression analyses and full, all this is in the report and available online. So older age adoption is a risk factor. So age 5 to 10 is a higher risk factor than aged over 11. So what is it about age 5 to 10? Is it that this group of children aren't being prepared properly? Is it because social workers find it harder to engage with age 5 to 10? Children aren't being prepared. They're not recognising children's existing relationships with the foster carer. They're not really understanding how important that relationship might be. Adolescence is the greatest risk, current risk, when children are currently adolescents. And as I've said, longer time in care. What was interesting was that single parents who adopted older children were less at risk of disruption compared to couples who adopted older children. And LGBTQ parents, no difference in risk than couples or single parents. Black children were at slightly elevated risk, but those children were older already when they entered care and when placed. So the age and ethnicity needed to be taken account of. So factors predicting SGO disruption. So older age again, but that difference between the ages isn't as marked as for adoption. It's still a great risk, but not as marked. Current age was again lower than for adoption, and that quick leaving within a year. Unlike adoption, it was only SGO children where the reason they entered for care had any association with later risk, and absent parenting was the reason associated with later risk. Absent parenting is something that social workers tip, meaning that parents are missing, they cannot be found, they've relinquished the child or they're dead. So a whole host of reasons. Thank you. Increased risk if they're a relative, and increased risk if the child was Black, even when we accounted for age at entry. So I'm not saying, so I just need to be careful here that it's not a causal effect. And the issue of ethnicity may be because Black carers, there are all kinds of systemic barriers that get in the way of Black carers being able to access support. Just building on the work of other researchers within the research, such as Priate's recent report on kinship carers and inability to access resources. Before the disruption, nearly half the children have been referred as a child in need. There were more child-related concerns for the children in adoption and more carer-related concerns for those in SG, particularly in SG, alcohol, drug misuse, and domestic abuse in SG families, and in the adopted families, sexual exploitation, sexual abuse, and going missing. Primary reason for return to care, abuse and neglect in the SGO families. It doesn't mean that the SG carer committed the abuse. It means that they probably couldn't protect the child. Family under acute stress in adoption, socially unacceptable behaviour, highly likely to be things like child-to-parent violence going on in those adopted families. And I think rather shocking, although it's only 4%, is that 4% of the SG children return to care because of low income, because local authorities are able to give SG families an allowance. So I just find, I find that shocking, really. So experiences after disruption. Most didn't go anywhere after the disruption. They stayed in care. The very young ones who returned to care under 11, some of the SG children had another permanent order. Some went to live with someone else who had parental responsibility, but we don't know who it was because it's not stated in the administrative data. The adopted children had lots and lots of placement moves, between 1 and 40 after going into care, which really suggests that they had a very high level of need, and more residential placements, even those under 11. And that's where they were as care leavers. So again, some were in adult social care, again suggesting high level of need. So the key takeaways: adoption and SGOs remain a stable permanency option. Older children face higher disruption risk. Special guardianship orders have higher disruption rates, but there are real issues of equity for the SG carers in terms of access to resources, access to financial support. Just treatment right across the system is so unreasonable and unfair compared to adoption. And should a children in need referral be a red flag, automatic red flag for adoption support? And I need to finish for questions, but I've already gone off my time.
Thanks very much, Julie. Very illuminating. As Julie said, the report is out, and we'll put links in the chat, hopefully, so you can access them. For those online, if you have any questions, please do add them into the chat, and we'll get around to as many as possible. But I'll open it out to the room first. Are there any questions from within the room that we can ask Julie? Don't be shy. I have a couple, but I'm not going to say it that way. Harriet, thank you.
Can I just observe, it just matches what we found with a sample who were born in 2007. So, and the bit about the special guardianship orders, they were placed with special guardians. Well, basically, the social worker knocked on the door and said, the parents can't look after this child. Could you just take them for a day or two? And not necessarily a grandparent, it might be an aunt. And in one case, was somebody who didn't even know the child. Could you just look after them for a day or two? Could you just look after them? Just hang on for a few more days, maybe a month, maybe 6 months. And then they're sort of long-term fostered with these special guardians. And then eventually SGO is made, and many of our special guardians did not realise that the fostering allowance ended when the SGO came in. So that was a major issue for them. They hadn't realised. And the other major issue for the ones who we spoke to, we interviewed, was they'd had no social work support in when the child was 8, in helping the child understand their identity, what it was. Some of them hadn't been able to bring themselves to say to the child, actually, I'm not your mother, I'm your grandmother. That the children didn't know that. So there's a huge amount. If you look at some of the qualitative stuff that sort of fits in with this, you'll find a huge amount of gaps in social work support and so on, which helps explain some of these findings. Thank you very much, Julie. It's fantastic, the study, isn't it?
On the first slide, there's a link because the study has its own website.
Yes.
And all the interview data and the reports will be on there as well, because we've been interviewing special guardianship families about their experiences. And in spite of all the years that have gone by since that study, Harriet, they're still saying the same things, you know, so
Still not
it's still like that.
Thank you, Harriet. Any more? Jude, just before we move to the next section, I think there's a question online that's coming in. We'll get to that next. You spoke about a quick exit from care not being a protective factor for special guardianship orders. Can you just elaborate on why? Can you hazard a guess when it might be, or what might be going on there?
Many things. When an adopted child leaves care, they have a full health assessment. You know, a really, really detailed health assessment so that the adoptive parents know in detail as much as they can about their genetic history, the birth parents, and it's predicted as much as it's possible what is likely in the future based on current knowledge. SGs get nothing.
Yeah.
They have to do a full preparation. Adopters do preparation training. They're taught about abuse and neglect, trauma, contact issues, all kinds of things. They have a full assessment. SGs might have an assessment that takes 3 days. The differences are so stark between the two groups.
And that highlights the issues of equity that you.
Equity is so not different.
We have a question on from online from Teresa, asking for clarification whether the CIN referrals were after permanency breakdown.
No, before.
Before.
50% before.
Okay, and she was wondering if that was why you're suggesting referral should be a trigger sort of red flag.
Yeah.
And how might the red flag work? Teresa's wondering, or you may not have formulated that yet, but.
Well, when it comes in through the front door, as a thin referral, it should be automatically linked to the adoption support teams.
And I guess we're working on a stability project here at Reece, so that we have some interesting conversations there. Right, I hope that answers your question, Teresa.